If you suffer from urticaria, also known as hives, is an outbreak of red bumps or welts on the skin that appear suddenly. The swelling that often comes with hives is called angioedema. Allergic reactions, chemicals in certain foods, insect stings, sunlight exposure, and medications can cause hives. It's often impossible to find out exactly why hives have formed. What causes hives? There are several types of hives including acute urticaria, chronic urticaria, physical urticaria, or dermatographism. Acute urticaria. These are hives that last less than 6 weeks. The most common causes are foods, medications, and infections. Insect bites and diseases may also be responsible. The most common foods that cause hives are nuts, chocolate, fish, tomatoes, eggs, fresh berries, and milk. Fresh foods cause hives more often than cooked foods. Certain food additives and preservatives may also be to blame. Drugs that can cause hives include aspirin and other non-steroidal and anti-inflammatory drugs such as ibuprofen, high blood pressure drugs, or painkillers such as codeine. Chronic urticaria. These are hives that last more than 6 weeks. The cause is usually harder to identify than those causing acute urticaria. For most people with chronic urticaria, the cause is impossible to find. In some cases, though, the cause may be thyroid disease and hepatitis infection. Chronic urticaria can also affect organs such as the lungs, muscles, and gastrointestinal tract. Symptoms include shortness of breath, muscle soreness, vomiting, and diarrhea. Physical urticaria. These hives are caused by something that stimulates the skin, for example, cold, heat, sun exposure, vibration, pressure, sweating, or exercise. The hives usually occur right where the skin was stimulated and rarely appear elsewhere. Most of the hives appear within 1 hour. Dermatographism. This is a common form of physical urticaria where hives form after firmly stroking or scratching the skin. These hives can also occur along with other forms of urticaria. How are hives diagnosed? You may be surprised the sheer number of questions that your dermatologist is asking you to find the possible cause of hives. Since there are no specific tests for hives or the associated swelling of angioedema, testing will depend on your medical history and a thorough exam by your doctor. Your doctor may do skin tests to find out what you are allergic to, or they may test your blood to see if you have an illness. How are hives treated? The best treatment for hives is to find and remove the trigger, but this is not an easy task. Antihistamines are usually prescribed by your doctor to provide relief from symptoms. Antihistamines work best if taken on a regular schedule to prevent hives from forming in the first place. Chronic hives may be treated with antihistamines or a combination of medications. When antihistamines don't provide relief, then oral steroid may be prescribed. For severe hives, you might need an injection of epinephrine or a cortisone medication. How can hives be managed? While you are waiting for hives and swelling to disappear, here are some tips. Apply cool compresses or wet cloths to the affected areas. Try to work and sleep in a cool room, and wear loose-fitting, light-weighted clothes. When should you call the doctor about hives? If you have hives with dizziness, wheezing, difficulty in breathing, tightness in the chest, swelling of the tongue, lips, and face, then contact your doctor right away. I hope you are learning something new from my videos. If you want us to cover a specific topic, let us know in the comment section. Thank you.